All right, let's talk about the different types of things you can inject. So technically you can inject cortisone, although that doesn't actually fix the problem. It just basically band-aids it. For regenerative medicine options, here's what you have. Prolotherapy, which is basically baby PRP. You have anything like a lidocaine or a diagnostic block, which is basically confirming an issue but doesn't actually fix anything. Then the next level would be ozone, taking a modified form of gas that helps with pain, helps with healing, can help with arthritis and other things. Then the next level are your true regenerative medicine options. You have different versions of plasma taking out of your blood, whether it's PRP, PRF, PPP, there's different variants. You have A2M, which is a variant of plasma that is specifically used for arthritis. Then you have what I call the stem cell lines. Now you have two stem cell lines that come out of us. That is bone marrow from our posterior hip and fat from usually our flank or our belly. And then you have several from a donor. These need to be properly screened, properly vetted, and properly stabilized and secured, whether they're in a freezer or they are shelf life stable. Now there are many different types of allografts, and including fat, amniotic tissue, or we call it connective tissue matrix, Wharton's jelly, which is umbilical cord, and then you also have different types of exosomes, which are basically the growth factors inside of stem cells. These can be from placental-based stem cells. These can also be from amniotic fluid. So you have a lot of different variants, and each of them have their own pros and their own cons. At the end of the day, I want you to think of these different lines as different levels of growth factors. Some of them may be really high in this one and maybe lower in this one. Other ones may be much higher in this one, but lower in this one. And a lot of the times we'll mix and match depending on what we're trying to achieve. A lot of places will only have one or two options. You need to find a provider that understands all of these subtle intricacies to make sure you're making the right decision.